How does an infection lead to a child's UTI? Imagine bacteria sneaking into a child's urinary system and causing trouble. A urinary tract infection happens when bacteria from outside the body enter the urinary tract through the urethra, which is the tube that carries urine out. The most common bacteria responsible is Escherichia coli, or E. coli, which normally lives harmlessly in the intestines. Sometimes, this bacteria can travel from the child's anus to the urethra and then into the bladder. Once inside, if the bacteria are numerous enough and can stick to the bladder wall, they start multiplying. This growth triggers inflammation, leading to symptoms like pain during urination, frequent urges to go, and sometimes fever. Children are more at risk of UTIs for a few reasons. Girls are more prone because they have a shorter urethra, making it easier for bacteria to reach the bladder. Poor hygiene habits, such as wiping back to front after using the bathroom, can transfer bacteria from the anus to the urethra. Not fully emptying the bladder or holding urine too long gives bacteria more time to grow. Constipation can also increase bacteria near the urethra and interfere with proper bladder emptying. Antibiotic use can sometimes kill the good bacteria that normally help keep harmful bacteria in check, allowing pathogens like E. coli to flourish. Some children may have genetic factors or bladder conditions that make fighting off infections harder. Structural issues like vesicoureteral reflux, where urine flows backward from the bladder to the kidneys, can also make recurrent infections more likely and may even cause kidney damage if untreated. When bacteria invade the bladder lining, they cause inflammation, which results in the classic symptoms of a UTI. If the infection is not treated promptly, bacteria can travel upward to the kidneys, leading to more serious health problems. Prevention is key and includes good hygiene practices, such as wiping front to back, staying well hydrated, and avoiding irritants like bubble baths. Treating constipation and ensuring the bladder is emptied regularly can also help. If a child shows signs of a UTI, a healthcare professional will usually prescribe antibiotics to eliminate the bacteria and prevent the infection from spreading or causing complications. In essence, a child's UTI begins when bacteria, especially E. coli, enter the urinary tract through the urethra. They then find a way to stick to the bladder walls, multiply, and cause inflammation. Factors like anatomy, hygiene, bladder habits, and antibiotic use influence how easily this happens. Understanding these factors helps in preventing and managing UTIs effectively. Always consult a healthcare provider for personalized advice and treatment options.